tests for schizophrenia, sir. The usual tests that happen for
Continuous better. ಈ ವಿಡಿಯೋ ಕಂಟಿನ್ಯೂಸ್ better.
The usual tests that happen for any disease, sir. There are no such tests for schizophrenia. Mental illness, there is no test, sir. So only by the way of talking, if we talk coherently or not, they see that, sir. First, like if I'm talking right now, am I making any sense? Am I talking logically? They see all these things and they figure out whether I have a problem or not.
So how does it feel when you are having schizophrenia? What kind of activities happen?
My brain goes haywire, sir. Thought process happens very quickly. Thoughts keep coming and going all the time. And my brain goes oscillation.
So what are the kind of actions?
Actions, for me personally, I become very violent. I start blaming my parents for many things if I see them. Or if I go outside, I pick up fights with people. I try to beat some people or they try to beat me. Things happen.
So is schizophrenia and depression same?
No, sir, not at all same. Schizophrenia, depression is the peripheral of mental illness, the very surface. The schizophrenia is very core, deeper, much deeper.
So you have mood swings?
Mood swings. When I am on medication, I am as fine as anybody else, sir, normal person. But when I am not on medication, mood swings don't happen for me.
But you go very aggressive.
Yes, but mood swings happen and the person is also talking illogical and behaving in a crazy way. That is bipolar. Again, they diagnose it in a different way. But bipolar and schizophrenia both are very much interconnected. Yes, sir.
So now with medication, are you feeling alright?
Yes, sir. With medication, I feel completely alright and I feel that I can work and function in a normal way.
Why did you stop medication in between then?
Actually, sir, this time what happened was I didn't stop my medication. As I said earlier, also I didn't get time here. So the dose which I was taking was not enough, sir. Doctor warned me previously only that this dose may not be enough in the future.
So you have to go for regular consultation.
Yes, sir. The doctor was seeing that and told that maybe I should increase your dose because you are going again off the line. But I said that no, I can manage.
So regular checkups.
Overconfidence.
So regular checkups and doctors' advices regularly should be there.
It is very much needed. Monthly checkups are very much needed, sir. Without monthly checkups, we cannot really tell what's going on in the patient's mind.
So as a patient now, how are you feeling?
As a patient now, I feel very fine with the medication what they are giving here, sir. Morning and evening, I am taking my medication. I am feeling very fine, stable, completely alright, emotionally stable, and I feel that I can also function normally when I go out, having a job and everything. So everything is fine, sir.
Okay. And how about your family relationships?
Family relationships, when this happens, schizophrenia for any person, family relationships generally get damaged, sir, because what we speak we don't know, sir, at that time. We speak whatever comes to our mind. We may hurt people also. Some people hit their family persons also. Some people even go on and kill also. We have seen news, many people do that also, sir. So family relationships always get damaged. But I feel that it's only family that stands firmly for a schizophrenic person. Without family support, it is very tough for any person to recover completely.
So that's very nice, Rahul, that you are able to give so much of information. So are there also cases where the person goes without eating food and he locks up himself and all those things?
Yes, sir. Without eating food and sleep deprivation. Sleep deprivation is the main thing, sir. Food may or may not be one of the things, but sleep deprivation is the main thing. Many people go days on without sleeping, and there are two things in the medical terminology. They say positive symptoms and negative symptoms. Positive symptoms is hallucinations and delusions, or delusions of grandeur and such things, and hallucinations. Negative symptoms are which come after taking medication, like depression and anhedonia, where we don't feel like fear is part of more like anxiety, you can say, sir. Not directly fear from something, but anxiety will be there for people. That is there. So these are all negative symptoms, sir. Positive symptoms only they first see, sir. if somebody is saying that I'm hearing voices, that is also one of the positive symptoms, sir.
Tell me one thing.
Yes, sir.
What, as per you, is the main reason for person getting schizophrenia?
For me, sir,
Is it emotional or is it some external forces?
main thing is I was under ganja usage,
Drugs.
I was using only ganja at that time, and emotional disturbance happened for me.
Emotional disturbances.
Yeah, both got combined and it resulted in me losing my mind completely.
So, person with drugs also without emotional problems can get schizophrenia.
With drugs and without emotional problems, yes, sir. Anything it can happen.
Or only with emotional problems also you can get.
Yes, without drugs, without taking any kind of intoxicants, just by emotional struggle or emotional disturbance also, or even without any emotional disturbance also, it can happen in any way, sir. Nobody can figure out. But certain times it all depends on the body chemistry, sir. How one's chemistry is. So there is no one reason for this. Nobody can pinpoint one reason. So far, science hasn't figured out any reason.
So now, would you like to continue being like this by taking that medication, or and have regular checkups, so that you know the doctor will be able to tell you if you are on the right path or not right path? Would you like to continue, or would you like to have a break again and then leave it?
I definitely want to continue like this, sir, for the rest of my life.
You feel good like this?
Yes, sir. Definitely, I feel good like this.
First, you are able to get the love of your family.
Yes, sir. Everything will be stable. Everything they will be very happy, sir. First thing is, sir, taking medication. This realization should, the insight should come into the patient, sir. For me, it took me around 4 or 5 years.
And you are able to carry out your responsibilities properly.
Yes, sir. I am able to do that. So this insight for me to develop, it took me this time, sir. So until then, I thought that no, medication is not for me. I don't want these side effects. I am fine with my whatever the craziness that I have. But that is very wrong, sir. In that, I would have lost my life many times. So definitely, this is the best thing for me. Taking medication and being stable and being happy with my family is the best thing for me.
Good. So Rahul, I wish you all the best and God bless you.
Thank you, sir.
So you are actually in class also. I have seen you. You are being very active and you are talking well and you are understanding everything that is being told. But your issue is something to do with your mental wellness,
Yes.
your mental health.
Yes, sir.
So this is health is wealth.
Yes, sir.
So when you know that health is wealth and there is only one treatment for your condition, then you should put all efforts to ensure that there is medication always with you.
Yes.
And you take your medication on time.
Yes, sir.
Then you are such a lovely person.
Yes.
You are such a wonderful person.
Yes.
You have got such a nice smile. You look so good. The issue is when you go on the extreme.
Yes.
When you go on the extreme, then it spoils everything. So if you realize this, then nothing like it.
Yes.
Okay? I wish you all the best and God bless you.
Thank you very much.
Thank you so much.